Hello and welcome. Thank you for joining me. Today we're going to briefly review the bag technique. All home health providers know about the home health bag technique, but are they all doing it correctly? If not, by the end of this short presentation, you will have all the knowledge to successfully perform the home health bag technique. In this presentation, you will learn when to perform the bag technique, why you need to perform the bag technique, and how to perform the bag technique. Let's review when to perform the bag technique. The bag technique is a best practice procedure that needs to be performed each and every treatment session. No excuses. Why should you perform the bag technique? Well, the primary aim of the bag technique is to prevent or severely reduce the risk of cross-contamination of microorganisms between you and your patient that can potentially cause infection. The bag technique is a proven infection control tool. Shortly, I will review the 6 steps you will need to take to successfully perform the bag technique. Some home health agencies teach the bag technique a little differently than others. Don't worry, the principles remain the same. Now I'll take you through the 6-step process to successfully perform the home health bag technique to keep you and your patients safe. Step 1. Placement of chucks and home health bag. After you enter your patient's home and identify the location where you will have your treatment session, this is where you will initiate the home health bag technique. You must always place the home health bag on an elevated surface, and your bag must be placed on a barrier. This barrier is the essential tool that will reduce the risk of cross-contamination between you and your patient. I recommend using a chuck. In my opinion, the chuck is the best barrier for the bag technique due to being super strong, disposable, as well as having a waterproof synthetic backing. The chuck is the gold standard for the bag technique. As you see in the photo, my home health bag is placed on the chuck and not touching any part of the patient's home. Let's move on to step 2. In step 2 of the bag technique, you must wash and dry your hands. This is the single most effective way to prevent infection. This must be done before you enter the clean area inside your bag. At the end of the session, I will share a link to the best practice resource video on how to correctly wash your hands. Step 3. Clean items clean. In this step, you must remove all clean items from the clean portion of your bag and place it on the chuck. Keep clean items clean to minimize the risk for them becoming contaminated or dirty. As you see in the picture, my pulse ox is clean and currently housed in a clean baggie. All your clean items must be stored in clean baggies. All the clean items from your bag are moved to the chuck. As you see in the photo, all items are out, clean and ready to use. Step 4. Close your bag and perform your treatment, utilizing all of the clean items needed to provide excellent patient care. Step 5. Clean, clean, dirty, dirty. After the skilled visit is over, clean all the used items that were in direct contact with your patient with disinfectant wipes. Put clean items back into their clean Ziploc baggies and back into their clean section of your bag. Put anything that is dirty and that you will not clean in a dirty plastic bag. This will be your dirty bag. Fold up the chuck and put it into the same dirty plastic bag in the dirty section of your home health bag. Some people teach to dispose of dirty items in your patient's home. I do not do this, but I do have my own dirty bag with disposable items that I've used that I later will dispose of outside of my patient's home. Step 6. Wash your hands. Mission complete. Now you know everything about when, why, and how to perform the home health bag technique. Thank you for your attention and your time. Always remember, perform the bag technique each and every session.